What is OCD? Are you a sufferer of OCD? Or do you know someone who is, such as a family member, friend, spouse, etc.? And if not, are you merely curious as to what OCD truly is? Well, whatever the case may be, today I will be informing you on what OCD is, the risk factors of it, some misconceptions of the disorder, and some possible treatments for it. Now, what exactly is OCD? Well, according to the National Institution of Mental Health, an article titled Obsessive Compulsive Disorder states that OCD is a common, chronic, and long-lasting disorder, one that affects an individual by having uncontrollable and recurring thoughts, known as obsessions, and or behaviors, known as compulsions. OCD is an anxiety disorder, one that is very common according to the Anxiety and Depression Association of America. OCD affects millions of people, approximately 1 to 40 in adults and 1 to 100 in children are affected by OCD in the U.S. Although OCD is a very common disorder, it is one of the most misunderstood. Some misconceptions of OCD are, an example, someone may think that they or someone else has OCD because a tilted picture frame bothers them so much, or that because they are such a clean and tidy person and that they have to have things organized in a certain way makes them OCD. But it doesn't, unless it is part of their compulsions and or obsessions. Because OCD is such a severe and chronic disorder, I would like to give a few examples of what someone with OCD may experience through compulsions and obsessions. Starting with compulsions, which are ritualistic repetitive behaviors, which are usually caused by obsessive and intrusive thoughts. An example of compulsions is someone checking the door is locked multiple times to make sure that no burglars come in, or touching specific or random objects a certain amount of times until it feels just right, or rereading a sentence or word in a book until they can proceed reading, which is known as reading OCD. The main reason people with OCD perform these compulsions is usually because of the anxiety caused by their obsessive thoughts. For example, someone may have a compulsion to touch a book a certain amount of times, and if they don't, their obsessive thinking will tell them, for example, that one of their family members will die. The main factors as to how OCD is developed into a person is unknown, but there are some risk factors, such as genetic predisposition, lack of neurotransmitters such as serotonin, the environment they grew up in, etc. OCD is also a disorder that has no cure, according to Very Well Mind, an article titled, Is There a Known Cure for OCD? By Owen Kelly, updated on November 13th, 2020. But there are some treatments that can significantly reduce OCD symptoms. According to Very Well Mind, an article titled, Treatments for Obsessive Compulsive Disorder, by Owen Kelly, updated on November 11th, 2020, states that there are multiple treatments to help diminish OCD symptoms, such as medication, like antidepressants, therapy, such as cognitive behavioral therapy, short for CBT, self-help strategies, among others. To recap, obsessive compulsive disorder is an anxiety disorder, one that is chronic, one that does not have a cure, but there are multiple treatments that can help diminish the effects and symptoms of OCD. And although OCD is a very, very common disorder, it is also one of the most misunderstood. OCD consists of obsessions and compulsions. Compulsions are the behaviors one does, and obsessions are the thoughts and intrusive thoughts that one experiences. And that is what OCD is. And even though OCD is a disorder, it doesn't mean that someone who lives with it cannot live a somewhat normal life, because they can, through medication, through therapy, self-help strategies, etc. Thank you.